Hey guys, Chandler here, back on my channel, Alternate Journey, and today I have a very informative video for you guys for trans masculine individuals who are considering going under the knife of getting top surgery, and then also for those who actually have their consultation scheduled. So these are very important questions that you should ask your top surgeon at the consultation. So this video might be a long one, and there are many different questions I have listed out for you guys, all with different certain categories. So down below will be timestamps of what category I will be talking about at what certain time. So let's get right started into it. You want to go to a surgeon who is experienced with this surgery, because although some might say this is a very simple surgery, it is very important to a trans individual's life. So the first question that you want to ask is if they are board certified, whether they are a plastic surgeon or a general surgeon. My surgeon personally is a plastic surgeon. You can ask them how long they've been working with trans and gender non-conforming patients. This may be considered very important to you, considering that you don't want to be their first trans patient or a gender non-conforming individual undergoing top surgery. You want to get someone that is experienced and knows what they're doing. You can ask how many top surgeons they have performed, and also ask how many of them have received revisions. And also, an important question to ask, especially depending on where you live, is ask if they are going to provide you with a letter for getting your gender mark changed. Because within certain states, you have to have at least one sex reassignment surgery. So definitely ask what surgeons do they offer. Whether some surgeons are just comfortable with just doing double incision with nipple grafts, but definitely ask if you are a candidate for keyhole surgery and whether or not they have performed any keyhole-like surgeries. Definitely ask them what techniques they have for reducing the chances of getting dog ears. If you do not know what dog ears are, they're what the trans community call this extra skin of flab right up here. This typically happens with larger chested individuals. So basically there's just excess skin right here and it just looks kind of like dog ears. Definitely talk about the size of your scars, the placement of your scars, the shape of the scars, the shape of your nipples, and also placement of the nipples as well, and the size of them. These may seem like stupid questions, but it's very important to ask what the surgeon is thinking, but also what you think as well. This is your body. You can have your scars shaped whatever you would like, whether you want them curved, whether you want them straight, whether you want them kind of jagged a little bit. It is up to you. It doesn't really matter. You can be sawed in half if that's your look. It doesn't really matter. Also, talk about nipple size, definitely, and try to ask your surgeon if they can make the nipple as circular as possible to make it look more cis. This may seem very stupid, but it is actually very important, because I have recently actually saw a video where a person where they didn't actually discuss this with a doctor, because typically when you think of top surgery, you think of the general trans scars underneath right here, you know. But unfortunately, when he got his drains out and the bandages all taken off to see his top surgery, unfortunately, his scars were above the nipple. And that's just what happens when you don't talk to your doctor, but also that is just like such a botched surgery if I've ever seen one. So definitely talk to your doctor and look at before and after photos as well. Ask them if they use drains and how long you will be wearing them for. My doctor, I will be wearing the drains for a full week before they can actually take them out and I can actually see my chest. Ask them if they do follow-up appointments and how many. And I cannot stress this enough, please ask them to look at before and after photos of as many patients as you want for both double incision and, if you are eligible for, keyhole as well. Although these may seem scary, it is very important to ask about risks of surgery. Ask them what are the chances of developing a hematoma, which is blood or bleeding underneath the skin, and also ask them the chances of developing a seroma, which is buildup of fluid where tissue has been removed from the body, which obviously this is top surgery. It is all the, sorry for this term, breast tissue taken out from your chest area. Yeah, so basically my doctor said that within her patients, only 10% of her patients has experienced this, and they were all majority people with larger size chest as well. So yeah, definitely just ask them what are their statistics with their patients, and you will get a better understanding of, you know, your risks. Ask them the risk of losing a nipple. This can be on both ends of the surgeon and also what you do during recovery. Sometimes the surgeon doesn't sew it on correctly or whatever, they just don't have the good techniques when it comes to grafting back on the nipple, or it depends on how you take care of your nipple when recovering. The nipple will look very disgusting for a while and very scabby, so it's very important not to pick at the scabs, but also when you take a shower, especially when you have really hard water coming down, do not face the water chest on. Face the water with your back and let the water just run down to the front of your chest. It is very important because the first couple weeks to a month, your nipples are very sensitive and just being they were also ripped off your body and sewed back on. You don't want just hard water to let them flush away, you know what I mean? So just be very careful with your nipples. It just sounds so weird, but it's true. Also ask what you need to know if you have a family history of breast cancer. So basically some surgeons will suggest that you get a mammogram before surgery. My doctor just personally touched me or whatever, and I don't have any lumps, so I'm good to go on with surgery. Of course, we'll check again before surgery time comes around. But she told me that once I have surgery, I will have a 98% chance of never getting breast cancer, which is amazing. Ask them when you need to stop taking testosterone. Usually they ask you to stop taking testosterone because testosterone unfortunately has the side effects of causing blood clots, and you do not want this when you're getting surgery and when recovering. Usually you will go back on testosterone a few weeks after top surgery. Ask if you need any blood work done before surgery. They typically do this 3 weeks before surgery because they just want to count your red blood cell count and everything like that. And there's so many other different things that they just need to know before surgery because obviously they're cutting into your body, you're gonna bleed, and they just know to need all these weird things. I'm not good, unfortunately, with the medical side of science, but they just need to know all these types of things so you can just are healthy during the surgery and you can recover at a normal speed and not get an infection, because that'd be really bad. Definitely ask what types of letters you need in order to get top surgery. Most surgeons need a letter from your therapist and a letter from a primary care doctor just to say that you are mentally stable to get surgery, and also just to know that you are in physical shape. You can find surgeons though that do not need any of these letters, although they are probably a little bit harder to find. And definitely ask when payment has to be paid, whether or not you need to make a payment for the surgery date, and then when the remaining balance is due. These are kind of basic questions, but they are good to know for the person that is going to surgery with you. So basically ask how long the surgery is going to be, how long you're going to be in the recovery room, what type of anesthesia you will be on. That's mainly for you, just to know, just in case you have certain side effects with certain anesthesia, if you know that you do or have any family history of. And then also ask, can you go home the same day? So for me personally, my surgery is going to take about 2 hours. I will be in the recovery room for an hour or so, maybe even a few more hours, just depending on how I feel, and then I can go home that same day. Well, my home being a hotel or Airbnb, depending. And then I see her the next day just to check if I have any hematomas or seromas, and yeah, and then a week later to get the drains out. That is my schedule for being in Maryland for top surgery. These are probably the most asked questions. How long do you have to stay in town for? Ask about any post-op appointments. Ask about what type of medications you will be on and how long. Whether or not you have to wear a binder and how long you're going to be wearing that binder. Usually you are given a hospital binder because it just keeps everything in place, and it also reduces swelling. Also, some say that helps with bruising. I don't know exactly how that works, but it could. Typically, most surgeons says that you need to wear this for 2 to 3 weeks. And then also ask when you can go back to work and the time periods of when you're expected to do most activities. If you have a desk job, you can go back to work within 2 weeks after surgery. But unfortunately, I have both very physical jobs, and my surgeon said that typically after a couple weeks, I can start driving again. The first month only lift up to 5 pounds, and then typically after 2 months post-op, most patients are back to their daily activities. Of course, start slow at first. You can't just jump right into it. You can also ask certain questions of when you are expected to have feeling within your chest and nipples, although unfortunately they can just give you an estimate time length of what their patients have told them, because of course every patient heals differently. Just like when someone goes on testosterone, everyone just has different side effects and like different timelines of when something happens to them. It is the same way from recovering from surgery. I cannot stress this enough. Definitely ask about revisions. Of course, that'd be amazing if you do not have to get any revisions. Definitely ask for like a percentage of like how many patients actually go get revisions, and ask if they do free or reduced price revisions. Most surgeons do like a free revision if if it was like a simple screw up, but if like you get dog ears or you don't like how your nipple is shaped, they will typically do a reduced price surgery. What types of insurance they accept, and then also if they do not accept any insurance plans, just ask if they do a payment plan, because unfortunately top surgery is pretty expensive. It can range from $7,000 to a whole like $10,000 depending on your surgeon, the procedure you undergo, and also you have to include travel expenses as well. I'm going to be in Maryland for a full week. I live in Brunswick, New York, and that's like 6 hours away, and it's just like all these things, all these components add up, and so total I'm saving $10,000 for my top surgery experience, even though my top surgery itself is only going to cost like $8,000. I hope this was very informative for you guys. Hopefully not too overwhelming, but these are very important questions that you should ask your top surgeon at your consultation. Most of the times though, most of these questions are answered by the top surgeon when you go to your consultation. So a nurse would typically tell you about the procedure, then your actual surgeon will come in, they examine your chest, tell you if you are eligible for keyhole or not, or just double incision, and if you are eligible for both, you decide, you tell them, and then they go through the whole process, they do their whole spiel, let them just do their spiel, and usually, if they are a very experienced surgeon, most of these questions will be answered for you, which is amazing. That just means that you can totally relax and everything, and just of course also feel for vibes. I'm a very vibey person, like I don't know, I can feel people's vibes, and my surgeon has an amazing vibe, and like I'm totally going with Beverly Fisher in Maryland because like I just trust her so much, and like her results are amazing. So I'm really excited for surgery. That's why I'm making this video, because I'm so excited, but also I want to share about the questions that you should ask at your surgery, because like you're there at the surgeon, yes, and it's like such a big step, but it's like, holy shit, wait a minute, what do I ask? Like, you've done all this research, so you feel like you know everything, but it's like, it's different when it's happening to you. You want to know everything that the surgeon suggests. Now, some of these questions may seem a little silly or just like, duh, of course, like I know where the scars are going to be replaced, but definitely just talk to your doctor about all these questions, because honestly, just take up the full hour. When you book a consultation, they typically expect the whole hour to be booked up. Don't just go in there, get your chest examined, and be like, okay, yeah, double incision nipple graft. There we go. Yeah, see before and after pictures? Oh, cool, you're pretty good, nice. And then just leave. Don't do that to yourself. Ask as many questions as possible. And ask again when surgery comes around. I'm definitely going to be talking to Beverly about like my nipple placement, my nipple size, scar placement, shape, whatever. I'm going to talk about all of that. Bring some pictures in. Just bring all the questions that you have. Some questions are not in here that, yes, you can still ask. It doesn't matter. But anyways, I hope you guys enjoyed this video. I know it was a lot of information, and if you want a copy of this list, please just DM me on my Instagram at alternate_journey. Just DM me and I will send you a picture of my journal here. You don't have to follow me or whatever. I'm just here giving out information. I don't care about that. So anyways, I hope you guys enjoyed this video. Please like, comment, and subscribe if you are new. I make videos whenever I can, but you can always expect updates on my transition. Alright.